My name is Abdul Rais. I'm a volunteer at Diabetes UK. This presentation has been designed as guide to managing diabetes during Ramadan. The presentation has been approved by clinical advisors at Diabetes UK and imams based in London. Introduction to Ramadan. Ramadan, or Saum, is one of the 5 pillars of Islam. Fasting during the month of Ramadan means abstaining from food and drink, amongst other things, for about 30 days. Most people take 2 meals, one meal before dawn, known as Sahri, and Iftar, the meal after sunset. The month of Ramadan follows the lunar calendar, so fasting is brought forward by 10 days each year. This year, it will begin on the 28th of June, followed by celebrations known as Eid al-Fitr. Who is exempt? According to the Qur'an and Sunnah, there are certain groups of people and circumstances where you may be exempt from fasting. For example, children under the age of puberty, elderly, the sick, those with learning difficulties, those who are traveling, pregnant, breastfeeding, and menstruating women. However, should any one of you be sick or on a journey, then he should fast a number of other days equal to the missed ones. As for those who fast with difficulty, they have a choice, either to fast or to feed a poor person for every day. Surah Baqarah, Ayah 184. What is diabetes? Diabetes is a health condition where the amount of glucose in your blood gets too high. This happens if your pancreas doesn't make any insulin or enough insulin to help the glucose enter your body's cells, or the insulin it does make doesn't work properly. Insulin is a hormone produced by the pancreas that allows glucose to enter the body's cells, where it's used as fuel for energy so we can work, play, and generally live our lives. It's vital for life. Glucose comes from digesting carbohydrates, which I'll talk more about later, and it's also produced by the liver. If you have diabetes, your body cannot make proper use of this fuel, so it builds up in the blood, which can be dangerous. There are 2 types of diabetes. Type 1 is where the body is unable to produce any insulin, which we need to break down the glucose energy in what we eat or drink. We don't know exactly what causes it, but we know it's not to do with being overweight. You can't prevent type 1 diabetes. It's usually diagnosed when you are a child or young adult. Approximately 10% of people with diabetes have type 1. Type 2 develops when the body cannot make enough insulin, or when the insulin produced doesn't work properly. Your family history, age, and ethnic background affects your risk of developing it. And you're more likely to get type 2 diabetes if you're overweight. It starts gradually, usually later in life. And because the symptoms may not be so obvious, it might be years before you learn that you have it. If undetected, can lead to serious life-threatening conditions. Approximately 90% of people living with diabetes have type 2. Importance of good blood glucose control. It's very important to have good blood glucose control if you've been diagnosed with diabetes. If your blood glucose levels are too high for too long, you can get extremely ill. Good glucose control helps reduce your risk of developing future complications such as blindness, heart disease, stroke, nerve damage, kidney disease. What is the impact of fasting on body? For someone who's fasting, it's the norm to feel hungry, thirsty, and lethargic, but this is often exaggerated in those with diabetes. Usually, your body enters into a fasting state 8 hours after the last meal. From this time onwards is when you are most likely to display symptoms of hyperglycemia. This may cause some difficulties in maintaining your blood glucose levels. Later on in the fast, your body will break down your fat stores for energy. If you have a blood glucose meter, it's important that you check your blood glucose levels more often during fasting. Potential risks when fasting. Risks of fasting with diabetes are hyperglycemia, hypoglycemia, and dehydration. Hypoglycemia, when glucose levels are too low. Shaking, sweating, blurred vision, tingling of the lips, irritability or anxiety, fast pulse, or palpitations. Not all people with diabetes will be at risk of hypos. Only those taking insulin or using certain medication. Speak to your doctor if you're unsure of your risk of hypos. Hyperglycemia, when glucose levels are too high. Thirst, going to the toilet more often, headaches, extreme tiredness, ketones, pear drop smell on breath, only for people with type 1 diabetes. Dehydration, feeling more thirsty, not going to the toilet as often, dry mouth, lips, and skin. Remember, testing your blood glucose levels doesn't break your fast. So if you're able to test your blood glucose levels more often, then do so. What are my options? Ideally, you should visit your doctor 2 months prior to Ramadan or at your annual diabetic review to discuss your options and review your medication. Healthcare professionals may categorize patients who would like to fast during Ramadan as either high, moderate, or low risk. If you're advised by your doctor not to fast, then it's important that you take this into consideration. Acknowledge that your GP has some understanding about your health, and you need to appreciate this. If you're unable to fast, you can offer charity or provide food for the poor. Speak to your local imam about this. It may be a good idea to do a couple of days in the month prior to Ramadan, Shaban, to see if one is capable of completing it without any complications. In some areas, there are education programs focusing on managing your diabetes during Ramadan. Patients who have attended this education program have had a significant decrease in hypoglycemia events. How do I manage my diabetes? It's important to always take your medication with your food, and during Ramadan, a suitable medication plan needs to be devised with your doctor or diabetes nurse. Without discussing your medication with your doctor or diabetes team, you may be at risk of hypos and hypers. A study found that the change in eating pattern during Ramadan increased the risk of severe hyperglycemia. Rigorous exercise is not recommended, as the risk of hypos may be increased. If you think that you're experiencing the symptoms of a hypo, you should break your fast. Make not your own hands contribute to your destruction. Surah Baqarah, Ayah 195. So it's important to look after yourself during Ramadan. If at any point you feel ill, it's important that you break your fast. Food choices. It's good to maintain a healthy diet during Ramadan. Before and after fasting, include high fiber food such as whole grain cereals, granary bread, brown rice, beans, pulses, fruits, vegetables, and salads. Foods high in saturated fats should be taken in small quantities, i.e. ghee, samosas, and pakoras. Healthy ways to break the fast include a handful of dates and lots of water to avoid dehydration. Take-home messages. Testing your blood glucose levels is important, and it does not break the fast. So if you do so, test more often. Consult your GP in advance. Look for signs of hyperglycemia, hypoglycemia, and dehydration. Remember that not all people with diabetes will be at risk of hypos. Only those with insulin or on certain medications. Make sure someone you know is aware that you are fasting. It's really important to let someone know that you have diabetes, because if you go into a hypo or hyper, then they would be able to respond more quickly. Always carry your glucose tablets, glucose gel, or a sugary drink. This may need to be followed up with a snack, like a piece of fruit, a biscuit, or half a sandwich. Finally, if you're ill, it's important that you break your fast. References. If you'd like more information, then please go to the Diabetes UK website and the Muslim Council of Britain's website. This is a study I referred to earlier about increased risk of hyperglycemia. And Imam Yunus Dadwala kindly checked all the ayahs and Islamic references for accuracy. If you have found this information useful, then help us reach more people and make Ramadan safer for people with diabetes. You can do this by texting the word Ramadan to 70123. Text costs £3 and one standard rate message. Diabetes UK will receive a minimum of £2.96. Thank you for listening to this presentation. I hope you have found it useful.